Hello, guys. Welcome to my channel, Medical Assistant with Miss K. If this is your first time visiting, welcome. My name is Kendra, aka Miss K, and I'm a medical assistant instructor. I've been a medical assistant since 2004 and a medical assistant since 2011. This video has been highly requested. I've had several of you guys ask me to do a video on medication classification and some examples. So that's what I'm going to be doing today. As I mentioned, I'm a medical assistant instructor. So for those of you that don't know, I help medical assistant students pass certification. So if you're in school and you're preparing for certification, I have a course study guide, an online study guide, which is also a refresher course at marefreshercourse.com. This is also for people who have maybe been out of school for a long time and you just need a refresher. Okay, so in the refresher course, I teach lessons, just like I'm teaching right now. I have video lessons, and then there are quizzes after each one. So this screenshot here is just showing you guys what is in the lesson. There's 12 modules altogether. In each module, I am teaching a lesson, medical law and ethics, as you can see on the screen there. Teach a lesson, and then at the end, there's a quiz. And then after you complete all of the module, there are practice tests at the end as well. Over 400 practice test questions to help you prepare. Or like I said, if you just need a refresher, you've been out of school for a long time, you never got certified, this is for you as well. So let's get into these medication classifications. One thing I do want to tell you, as I always do, if you're in school, although I'm a medical assistant instructor, if you're in school, just take what I'm teaching as just something additional. I don't want to replace anything that you're learning in school. If you're a medical assistant instructor and you happen to use my lessons, that's fine as well. But I just want to give that disclaimer, okay? All right, so let's get into these medication classifications. So we're going to talk about medications and we're going to go over some examples, okay? So the first thing I want to talk about are the different types of medication classes that you have to know. As a medical assistant, you need to know these things anyway, but if you're preparing for certification, you will see some questions on the test that may ask you about what an antitussive is, right? As you can see, that is a cough suppressant. An example is Robitussin. So as we're going through each medication type, we're going to go over some common medications, okay, within that class. An expectorant is a cough medicine that loosens mucus, okay? An example of that is Mucinex, right? A decongestant, it loosens mucus congestion. An example of those decongestions are Flonase and Sudafed. And antihistamine is used for allergies, right? Benadryl and Claritin are examples of that. An antiemetic is used for nausea. Zofran. So the way they may ask you on a test, they may say Zofran is an example of which type of medication. You have to know it's nausea, right? Anticoagulant, that is a blood thinner. You have warfarin or heparin. An antipyretic, this is a fever reducer, okay? Pyretic refers to fever or hot. It's the medical term for pyretic means hot, right? Fever in this case, okay? A hypotensive, it lowers blood pressure. Okay, hypotensive, remember hypo means low, hypo or low or decreased, right? It lowers blood pressure. An example of that would be amlodipine. Okay, a vasodilator. What do? They widen blood vessels. Okay, and this lowers blood pressure. Okay, an example of this would be lisinopril. The opposite of that would be a vasoconstrictor. So instead of widening the blood vessel, it narrows the blood vessels. Okay, in this case, the blood pressure needs to be raised. An example of this would be epinephrine. Okay. More classifications. Then we have antibiotics. The antibiotics, they kill or inhibit bacterial growth. An example of that would be amoxicillin or Cipro. A beta blocker. These are used to lower heart rate and blood pressure. An example of that would be metoprolol. Now, I'll give you guys a kind of a hint here. You know amoxicillin, penicillin, you guys know those are all antibiotics. So certain medications, you'll be able to know what they are just based on the end of it, the suffix, right? Even like metoprolol. When you see those medications, those old laws, I always say like metoprolol, atenolol, propranolol, right? Those are beta blockers, okay? And they lower heart rate and blood pressure. A diuretic, they increase urine output to reduce fluid retention, okay, or blood pressure. An example would be Lasix. A bronchodilator relaxes airway muscles for easier breathing. An example of that would be albuterol or ProAir. An analgesic is responsible for relieving pain, okay? An example of that would be Tylenol. And then we have NSAIDs. NSAIDs, which are non-steroidal anti-inflammatory drugs, they reduce pain, fever, and inflammation. Okay, an example of this would be ibuprofen or the brand name Advil. Okay. Now let's talk about the different type of uses. We have the therapeutic use. Okay. Well, the different terms. Well, we're going to talk about uses in a few minutes, but we're going to talk about three different things you need to, know the difference between the use, the action, and the legal class. Okay. So the therapeutic use is simply what is used for. Okay, what it treats. For an example, does it lower blood pressure? Okay, that's the therapeutic use. This is why the provider is prescribing the medication. Okay, if they want to lower blood pressure, right? That would be a use. The mechanism of action is actually what it's doing inside of the body, okay? How it works. Blocks, like for an example, blocks certain receptors, right? Like maybe the histamine receptor for when we're taking allergy medication, right? So we'll talk about that in a few minutes. And then the legal class refers to, whether it's a prescription drug. OTC means over the counter, or controlled substances. Now, we're not going to get into controlled substances in this video, but I have talked about it in certain videos on this channel and in my refresher course as well. Okay. All right. So, what is a precaution? Precaution are, these are situations where a drug can be used, but with caution. Okay. So, for an example, metformin in patients with kidney disease, it must be used cautiously. Okay. So, a precaution, this is where the medication can be taken, but you have to be mindful. Okay. You got to use it cautiously. Another precaution example may be, before you take this medication, if you're pregnant, check with your doctor, right? Because it can interfere. Certain medications may interfere with the fetus, right? A contraindication. These are situations where the drug should not be used due to a serious risk. Okay, a contraindication example would be if a patient has an active gastrointestinal bleeding, right? And then they get prescribed a blood thinner like Coumadin, that can be an increased risk of life-threatening hemorrhage, right? If a person already has internal bleeding and then they're prescribed a blood thinner, they are very likely or have an increased risk of life-threatening hemorrhage, okay? A side effect. What's the difference between a side effect and adverse reaction? A side effect, this is an expected, often mild and predictable effect that occurs in addition to the desired therapeutic effect. So it's usually not harmful. This usually happens in addition to what the therapeutic effect is, like meaning what the doctor wanted to happen. Something else may happen as well, right? That's a side effect. So like drowsiness, if you take Benadryl, you'll be drowsy. That's not the therapeutic effect, but it's a side effect, not harmful, unless you got to drive or work, of course. And then and another example is like mild nausea after you take an antibiotic. So these are side effects. They could be, they could ruin your day if you're working and you're nausea, you could feel miserable, but it's not necessarily, harmful to you. An adverse reaction, though, now this can be harmful. It is unexpected, more serious, and potentially harmful. It can be mild, moderate, or severe, and in some cases can even be life threatening. An example of that would be anaphylaxis, okay, which is a severe allergic reaction after maybe taking penicillin. There's a lot of people with a allergy to penicillin, but that's an example of an adverse reaction, okay? Or liver damage from high doses of certain medications, okay, like Tylenol, acetaminophen is one. High doses of too much of acetaminophen can cause liver damage. So those are the differences between a side effect and an adverse reaction. All right, so let's talk about the difference between the generic name, the trade name, and the chemical name. The generic name is the official non-branded name, okay? Like ibuprofen. I can never, why can I never say ibuprofen, guys? Ibuprofen, okay? um, the trade name is the brand name. So that's the name that you see on the commercials, right? That's your Advil, that's your Motrin, right? Nobody can go create a medication called Advil Motrin because it's branded. It's a trade name, and you'll usually see the TM sign, the trademark sign, the registered sign behind the names. That's how you'll know it's the brand name or trade name. And usually when you see the trade name and generic name beside one another, usually the trade name will be capitalized, and usually the generic name is lowercase. So that's one way to know the difference too. So just remember the generic name is the official name. Okay. And this is why. So just side note, I remember having patients that were asked, why does my pill look different every time I go to the pharmacy to pick up my medication? It's because they're getting a generic. The generic is the official name. So there may be different pharmaceutical companies making that same medication. So every time they go to the pharmacy and get a generic, there's a different company that is distributing that medication. So that's why sometimes they say, first my pill was round, and then it was oval, and that's just because it was probably generic. Just wanted to make that side note. Okay, and then the chemical name is the scientific name. It describes the structure of the drug. Now, I'm not even about to try to read that chemical name, but just make sure you know that's the scientific name. That is what the drug is made up of. All right, so let's look at some different medications. Now, we're going to go over a few medications together. We're going to look at the generic name and the brand name. So the brand name you'll see in parentheses. We're going to go the pronunciation of the generic, and then we're going to talk about the classification, the action, and the use. Okay. So let's get into it. So lisinopril. So lisinopril is a generic name. That's a blood pressure medication, right? The brand names are Zestral or Prenavil. Pronunciation is lisinopril. Now, this is very important. When you guys get out there, you're going to be seeing a lot of medications that you've never seen before, right? You're not going to know how to pronounce it sometimes, but this is why it's so important to look up the pronunciation of certain medications. And the more you see certain medications, the more familiar you'll become. So I work in cardiology, and I've worked in cardiology for a long time. So certain medications I already know. Like, we see this medication a lot. And then depending on where you work, certain meds you see, you're going to just know, oh, that's a blood pressure medicine, right? Or that's a diabetic medication. Or you'll be like, that's a, antibiotic or whatever. So although there's a lot of medications, I don't want you guys to get stressed out. I just want you guys to really focus on learning some common medications. And then depending on where you work, your specialty, then I want you guys to focus on learning medications. Like I work in cardiology. So I just created a list of common cardiac meds. So that way all of the, the medical assistants and the nurses, they can be familiar with any cardiac meds, including blood thinners, blood pressure medications, anything relating to cardiology. Okay, so let's get into this. Lisinopril, the classification is a ACE inhibitor. And this, how ACE inhibitors work, they block this angiotensin, which causes the blood vessels to constrict. Okay, so ACE inhibitors, it prohibits that, right? It actually helps the blood vessels relax, so it can lower the blood pressure. Okay, so that's how it works inside the body. That's the action. And what is it used for? Hypertension as well as heart failure. Okay. Next medication we're going to go over is metoprolol. So remember, I told you guys that when you see those, those law medications, atenolol, metoprolol, propranolol, you guys will know those are the beta blocker medications. And how do they work? They decrease heart rate and blood pressure. What is it used for? Hypertension, angina or chest pain, or post-MI, myocardial infarction or heart attack. Okay, so metoprolol. The brand name for metoprolol, you have Lopressor, and you also have Toprol XL. And then next we have amlodipine. The brand name for amlodipine is Norvasc. The pronunciation is amlodipine. Well, I just said amlodipine. Classification is a calcium channel blocker. How does that work? It relaxes blood vessels. And what is it used for? hypertension, as well as chest pain. Atorvastatin. What is atorvastatin? This is a cholesterol medication. The classification is statin. So this is another one that you'll be able to recognize, the statins. When you see the statins, atorvastatin, rosuvastatin, lovastatin, you guys will know that statins are cholesterol medications, okay? It reduces cholesterol production. The use is for high cholesterol as well as stroke prevention. Simvastatin, here's another statin, brand name Zocor. Classification again is statin. How does it work? It lowers LDL, which we call the bad cholesterol, and it raises HDL, which we call the good cholesterol. What is the use? It's used for high cholesterol. Next, we have albuterol. Brand name is ProAir and Ventolin. And again, you have the pronunciation here, guys. So when you're not able to pronounce certain words, just always just look up the pronunciation, okay? Because I'm sure there are some medications that I probably was saying wrong as well before I learned the pronunciation of it, okay? Classification is a bronchodilator. And how does it work? What does it do? It relaxes airway muscles, and it's used for patients with asthma and COPD. Omeprazole. Brand name is Prilosec. You guys probably see that on a commercial. Remember, the brand name is that name that you see on the commercial. It's branded. It's a trade name, okay? Classification is a proton pump inhibitor. And how does that work? It blocks gastric acid secretion, used for patients with GERD and ulcers. What is that? The gastroesophageal reflux disease, as well as ulcers. Next, we have pantoprazole. Brand name is Protonix. Classification also a proton pump inhibitor. It decreases stomach acid, used for patients with GERD or erosive esophagitis or inflammation of the esophagus. And how do we know that? Because itis is inflammation, right? And then we have levothyroxine, which is Synthroid. Now, this is one that I was definitely pronouncing wrong for a long time. When I would have patients coming and taking this, I always would say levothyroxine, but it's levothyroxine. Classification is thyroid hormone. The action, it replaces thyroid hormone for patients with hypothyroidism, okay? Metformin, brand name is Glucophage. Classification, what is this? Biguanide. I'm pretty sure I said that correctly. Finally, I think I said biguanide before, but it's biguanide. What does that do? It decreases hepatic glucose production. What is this used for? Patients with type 2 diabetes. Insulin. So guys, you know I'm on a busy street and I live near a hospital, so please excuse the sirens going by. I live on a very, very busy street, and the hospital is like 2 blocks away. So you probably hear sirens in my background. I am so sorry. All right, insulin glargine, Lantus brand name. It is the classification is long-acting insulin. What does it do? It lowers blood glucose, used in patients with type 1 and type 2 diabetes. Furosemide or Lasix. You may have heard of Lasix. The classification is a loop diuretic. And what does it do? It inhibits sodium reabsorption. The use is for edema and hypertension. Hydrochlorothiazide. Now, this, you may look at this one and say, what? Hydrochlorothiazide? I'm only used to saying it because being in cardiology, we have so many patients that come in that's on that. But another name we say HCTZ. So that's how we kind of shorten it up, HCTZ. The brand name is Microzide. It's also a diuretic, which promotes sodium and water excretion. Is used for patients with hypertension and fluid retention. Losartan. Cozar is the brand. Losartan is the generic. Its classification is an ARB. So similar to the ACE inhibitors, it also lowers blood pressure by relaxing blood vessels. It blocks that hormone I mentioned. I mean, it blocks that enzyme I mentioned, the angiotensin, which causes the blood vessels to constrict, which will raise blood pressure. The use is for patients with hypertension and then diabetic nephropathy. Gabapentin. Now, some of the actions you'll notice are very simple, and some of them are very what's the word, very scientific. Some of these I made simple just so it's easy to explain it, because some of it will cause us to have to pull out a dictionary. So I said, let me make this as simple as possible. But anyway, gabapentin, the brand name is Neurontin. Classification is an anticonvulsant. The action, it reduces the excitability of nerve cells in the brain. The use is for seizures as well as nerve pain. And when it reduces the excitability of nerve cells in the brain, it kind of makes medications that do that, that reduces the excitability of nerve cells, it kind of tricks your body into like not feeling the pain. Like whatever's going on could still be there, but it relaxes the excitability of nerve cells. So it kind of makes you not feel the pain as much. Same thing with the I think we'll get to it in a minute, like an analgesic. Okay, sertraline. Zoloft is the brand. Classification is the SSRI, which is a selective serotonin reuptake inhibitor. These are antidepressants. Okay, it works to it increases serotonin, which is your happy hormones. It increases the levels in the brain. It is used for patients with depression, anxiety, or PTSD. Fluoxetine, brand name is Prozac, also a SSRI. It boosts serotonin, used for patients with depression, OCD, or obsessive compulsive disorder, or panic disorder. I didn't realize I had so many antidepressants in a row. I was listen. I didn't realize. Okay, but citalopram is Celexa is the brand name. Classification also SSRI. It enhances serotonin and the what enhances serotonin action, and then the use is for depression. Okay, escitalopram or Lexapro, also an SSRI. It blocks serotonin reuptake, used for depression and generalized anxiety disorder. And like I said, I didn't realize I had so many. I think because I have so many medications, guys, and I'm just breaking it down. I think it's 25 on here altogether, but I just kind of looked up common medications, right? To share with you guys. And then I have 100 altogether, but I'm only doing 25 today. So I'll be doing more parts to this. But anyway, loratadine is Claritin. I'm pretty sure all of you guys have heard of that if you have allergies. It's an antihistamine. It blocks H1 receptors, which is the histamine that, causes us to sneeze and all of that nasty stuff that we hate during the allergy season. I don't know about you guys, but I have terrible allergies. The use, allergies and hay fever. Cetirizine, Zyrtec is the brand name. It's also an antihistamine. It competes with histamine for receptors. It's used for allergies and hives. Diphenhydramine, Benadryl, also an antihistamine, which blocks H1, right? Allergies, motion sickness, and sleep aid is what it's used for. Acetaminophen, Tylenol is a brand. It is an analgesic and antipyretic. So analgesic, as we learned in the beginning, is a pain reliever, right? And then an antipyretic is a fever reducer. The action, this is one of the ones that I had to make super simple, but it simply makes the body less sensitive to pain signals. The use is for pain as well as fever. I don't know about y'all, but Tylenol does nothing for me. Tylenol, or it what made me think of it is a friend of mine. She was just recently sick, her and her son, and they had fever and they were taking Tylenol and it just wasn't doing. I was like, girl, you need some Motrins. I don't know about you guys, but Tylenol does nothing for me or my daughter. When she was a baby, I would try Tylenol for her fever. Nothing. Motrin, oh, knocked it right on down. But anyway, that was a quick side note. Speaking of Motrin, it's an NSAID, as we mentioned earlier. Ibuprofen is the generic, Advil and Motrin are the brands. It blocks COX enzyme as well as reduces inflammation. Is used for pain, fever, and inflammation. And let me see, did I make a note on this one right here? No, that's it. And COX enzyme is just for it causes pain and inflammation. Let me see. Sorry guys, I got some notes here. I didn't make a note about this one. Okay. All right. Naproxen, also an NSAID. Aleve is the brand. Makes the body, again, simple action. I make it super simple. Makes the body less sensitive to pain signals. The use, pain, arthritis, and inflammation. Okay, guys, that was it for now. As I said, there was 25 altogether. I didn't want this video to be too long. So this is why I just wanted to go over the 25 with you guys. Make sure if this video was helpful, you like the video. I see the comments here, guys. Yes, this will be posted afterwards. Yes. So if this was helpful, do me a favor and like the video. If you haven't already, make sure you subscribe to my channel. I will be doing more. This is it for now. If you need some additional help, you guys know you can go to my MA refresher course. It is an online study, guys. This is for anybody that is in school that's preparing for certification, or if you've been out for a while and you need a refresher and you need to get certified, it's for you as well. So hopefully this was helpful, guys. I will come back with another part. I don't know when. I'll let you guys know when, but we'll do another 25. So I hope that this was helpful. Again, like the video, subscribe, and you all have a blessed day. Check out the description box for all my links to, if you're getting ready for externship, there's a tracker there you can use for yourself, just for yourself to track what you're doing. Just a whole bunch of other stuff in the description box you can check out. You guys have a great day. Be blessed.